Los Angeles. Maria Isabel Bueso was 7 years old when she came to the United States from Guatemala at the invitation of doctors who were conducting a clinical trial for the treatment of her rare, disfiguring genetic disease. The trial was short on participants, and thanks to her enrollment, the Federal Drug Administration eventually approved a medication for the condition that has increased survival by more than a decade. Now 24, Ms. Bueso has participated in several medical studies. She has won awards for her advocacy on behalf of people with rare diseases, appearing revenue, on top of a Zomato Gold sign-up fee of about $550, she said. Gold users, who pay about $14 for a year of buy one get one free dining at 6,000 restaurants, are often rude and demand extra discounts, she added. And Vanilla pays Zomato a steep commission of 28% on every order that is delivered. A Zomato is the greatest thing to happen to a customer, Ms. Porwell said. The consideration for restaurant owners is literally nothing. Now, in a collective primal scream, India's restaurants are rebelling against Zomato and other leading dining apps. 2 weeks ago, a group of restaurant owners near New Delhi called for an end to the steep food discounts constantly offered by Zomato and competitors like Swiggy and Uber Eats. They argued that the costs fall on eateries while the apps reap the rewards. The protest, which has drawn public support from thousands of eateries, has its own hashtag, #LogOut. Many have either left the Gold program or have pledged to do so. The consumer believes that a discount has been his right, not a privilege, said the leader of the insurrection, Rahul Singh, who is the chief executive of the beer copyright restaurant chain and the president of India's National Restaurant Association. But all of this is coming out of the restaurants' pockets. The frustration goes beyond India. As food ordering and delivery increasingly move online, restaurateurs and delivery workers around the world are questioning the small share of the pie they get from powerful gatekeepers like Zomato in India, Grubhub and DoorDash in the United States and Deliveroo in Europe. The apps have made it easier for people to order takeout meals, and restaurants have gotten exposure to a larger audience of diners. But the platforms also charge hefty commissions on each order and can squeeze the profit margins of culinary establishments. In the United States, some restaurants have closed, unable to keep up with the cost of working with the delivery apps. The revolt in India underscores how tense the relationship between restaurants and the dining apps have become. The customer is addicted now, Satish Meena, a senior forecast analyst in the New Delhi office of Forrester, a global tech research firm, said of the apps. They have trained the customer that if there is not a discount today, I'll wait because tomorrow there will be another discount. The Indian food delivery apps said they provide a valuable and costly service that is underappreciated by their restaurant partners. But they are also making some changes in the face of the rebellion. Shortly after the #LogOut campaign began, Zomato's chief executive, Deepinder Goyal, apologized on Twitter for the financial pain that a bargain hunter saw had caused some restaurants. Last week, he sent an email to all of the Gold restaurants announcing 10 changes in response to their concerns, including a once-a-day limit on usage and a doubling of the annual subscription price against those who do not leave the country. I have been told by USCIS there is no appeal, and nobody has told us how to proceed, said Martin Lawler, Ms. Bueso's attorney in San Francisco. She cannot leave the United States. She will die. Every week for several years, Ms. Bueso has received intravenous infusions of the replacement enzyme that treats her disease, mucopolysaccharidosis 6, or MPS 6, which causes dwarfism, clouded vision, and spinal cord compression, among other abnormalities. Stopping this therapy will dramatically shorten her lifespan, said Paul Harmatz, the pediatric gastroenterologist who was involved in the original trial and has been treating Ms. Bueso since 2003 at the UCSF Benioff Children's Hospital in Oakland, California. The new policy may prevent an 8-year-old girl with nerve cancer from participating in an experimental treatment at Memorial Sloan Kettering Cancer Center in New York. Her father, who is in the country illegally, is the only parent who can travel with her because her mother, an American, recently had a stroke that impaired her vision and ability to drive, said Tammy Fox Isaacoff, a Miami immigration lawyer who is representing the family. Without deferred action, the man cannot legally drive or board an airplane from Miami to New York, where the girl must go each month for the treatment. Brent Renison, a lawyer, is representing an Indian woman who the government has not permitted to stay in the country, even though she is waiting for a green card, because her husband, the sponsor, died. He said deferred action is meant to allow for some discretion, to recognize cracks in the law that people fall into, and alleviate humanitarian situations and needless suffering. For the administration to take this away means the end of humanitarian relief as we know it, he said. In another move unveiled earlier this month by the Trump administration, crime victims who have helped law enforcement authorities with investigations will find it much more difficult to remain in the United States. The Special Protective Visa, known as the U visa, has a years-long backlog. ICE said this week that, unlike under prior administrations, it would no longer heed the advice of visa adjudicators whose early, preliminary approvals used to qualify immigrants for a temporary stay, or pause on their deportation cases, until a final determination could be made. The new policy could affect about 140,000 people currently waiting for U visas, plus their dependents. Kenya Martinez of El Salvador, who has been living in the United States since 2004, is among those waiting. She was sent to a detention center in Louisiana this week in preparation for removal from the country, after her application to pause her deportation proceedings was denied. Previously, Ms. Martinez, who has 2 sons, would have been eligible to halt her removal because of her pending application. In 2014, when Ms. Martinez first qualified for the visa, she had fresh bruises and cuts that were noted by police officers who had responded to a call about domestic violence, according to paperwork signed by her local police department supporting her application. She cooperated fully with the investigation, said the documents. Cecilia Friedman Levin, Senior Policy Counsel for ASISTA Immigration Assistance, a group that advocates for victims of physical and sexual abuse and human trafficking, said that the change is counter to the intentions of the bipartisan congressional group that created the U visa nearly 20 years ago. It compromises victim safety and it creates a chilling effect on survivors to come forward, said Ms. Friedman Levin. In Guatemala, doctors told Ms. Bueso's parents that their daughter's life would be short. When Dr. Harmitz learned Ms. Bueso had the rare enzyme disorder, he wanted to include her in the medical trial. "We could not have done the clinical trials without her," he said. "We were struggling to find patients. The dramatic breakthrough that came from the trial has helped people with the disease live longer than 30 years, he said. Before the drug, they rarely survived past 20. It has been 16 years since Ms. Bueso began receiving weekly 4 to 6-hour infusions of the drug, Naglazyme, at the hospital. She has built a productive life despite the crippling disease. Last year, she graduated summa cum laude from California State University, East Bay, where she worked with the school to start a scholarship for students with rare diseases. She has traveled and made presentations to lawmakers on behalf of people with rare diseases. Her family lives in a tidy house in a middle-class neighborhood in Concord, California, which her parents bought and renovated to accommodate their daughter's wheelchair. They did not expect to leave the country, having won permission to stay every time they reapplied for an extension. When Mr. Lawler, the family's lawyer, told them about the government's decision last week, Ms. Bueso began to shake uncontrollably. "We were crying with the nurses, doctors, everyone," said her mother, Carla Bueso. "Without her treatment, it's like a death sentence. It has been hard to process. Neither the drug nor the medical care that she requires is available in Guatemala. Without the drug, her health is expected to quickly deteriorate. Her breathing could become belabored, she could suffer cardiac arrest and become susceptible to infections. We have watched her grow up and mature, and become a responsible young adult," a leader advocating nationally, said Dr. Harmutz. If you take it away, it will be a rapid return to her previous state. Death would be the outcome.